Hi friends, today we are going to discuss about menstruation or period. Periods or menses define as monthly cycle of sequence of events that occurs in woman's body, specifically in uterus, as uterus prepares itself for possibilities of pregnancy in each month by becoming thicker and richer in blood vessels. If pregnancy does not occur, these lining shades accompanied with blood and menstruation occurs. Menstrual flow is partly blood and partly tissue of uterus. Flow starts from uterus and it goes via cervix, expelled out of the body through vagina. After pubertic age, females experience menstrual bleeding once in a month. Average cycle is 28 days long. However, its length may vary from 21 days to 35 days. This cycle is controlled by a complex orchestra of hormones that are chemical messengers. These hormones mainly produced by pituitary gland and hypothalamus along with ovary. Now menstrual cycle is divided into four phases. First phase is menstruation or menstrual phase. It lasts for 3 to 7 days. Second is follicular phase that lasts for 11 to 17 days. Ovulation, which specifically occurs on 14th day, and last is luteal phase, which duration is 15 to 18 days. Now we'll see each phase in more details. First come is the menstruation or menstrual phase. This is the first phase of menstrual cycle. It lasts for 3 to 7 days. Sometimes some females may have longer periods than others. This fluctuation depends on the physical capacity and body structure. Menstruation starts when an egg from previous cycle is not fertilized because pregnancy has not taken place. Here level of progesterone and estrogen, that are the hormones, drops. Thicker lining of the uterus which there is to support pregnancy is not more needed, so it shades through vagina combined with blood, mucus and soft tissues. 10 to 80 ml is considered as the normal flow. Volume. You may have symptoms during this phase like abdominal cramp, irritability, tender breast, headaches, bloating, tiredness, or you may have mood swings and low back pain. These are normal. Now we'll go through the second phase, that is follicular phase. This is the second phase and it also overlaps with the first phase. That means it starts on the first day and ends on the 14th day when you ovulate. On an average, these last for 14 days, but duration may vary from 11 to 17 days. It starts when hypothalamus sends signal to pituitary to secrete FSH, that is follicular stimulating hormone. FSH stimulates ovary to produce 5 to 10 small sacs called follicle. Each follicle contains immature egg cell or oocytes. Eventually, healthiest of the oocytes matures to form egg. Sometimes two egg cells mature at the same time, but it is rare. Rest of the follicles will be reabsorbed by the body. If two cells mature at a time, then twins may happen. Maturing follicle sets off surge in estrogen that thickens lining of uterus. This creates a nutrient-rich environment for embryo to grow. This all happens if pregnancy takes place. Now the third phase, that is ovulation. Rising estrogen level during follicular phase, that is the second phase, triggers pituitary gland to release LH, that is luteinizing hormone. Luteinizing hormone starts process of ovulation. When ovary releases mature egg, this process is known as ovulation. Egg travels down to uterus via fallopian tube to be fertilized by sperm. Ovulation is the only time during the cycle when you can get pregnant. You can guess that you are ovulating by symptoms like slight rise in basal body temperature and thicker discharge that has texture of egg white. Ovulation happens on the 14th day. But if you have 28 days regular cycle, it lasts only for 24 hours, that is one day. After a day, the egg dies or dissolves if it is not fertilized. Now the fourth and the last phase, that is luteal phase. After the follicle releases egg, it changes into corpus luteum. Corpus luteum releases mainly progesterone and some estrogen. This rise in hormone keeps uterine lining thick and ready for fertilization or the fertilized egg to get implant. If the female get pregnant, her body will produce HCG. HCG is detected in pregnancy tests. HCG helps maintaining corpus luteum and thicker uterine lining. If the female didn't get pregnant, corpus luteum shrinks away, leads to decrease in the level of estrogen and progesterone, which causes onset of menses or periods. Luteal phase lasts for 11 to 17 days. Average length is 18 days. During this phase, a non-pregnant female may experience PMS, that is premenstrual syndrome, which includes symptoms like bloating, breast swelling, pain and tenderness in breast, mood changes, food cravings, headache, weight gain, changes in sexual desires, trouble sleeping, and etc. Thanks. This is all about the menstruation. Thanks for watching. If you like, then subscribe our channel.